Reform or die, that's the warning about the National Health Service from Keir Starmer, the Prime Minister, today. But don't worry, he says he's got a plan to radically transform the NHS. It's just it'll take a decade. We'll discuss what's in it on this episode of the BBC's daily news podcast, Newscast. Hello, it's Adam in the Newscast studio.
And Chris in the Newscast studio.
Except, are we in the Newscast studio?
I know.
Existential question.
So we're both at Westminster in the little studio that we used to use for the televised version of Newscast.
Oh, yeah, because when I speak to you and you're at Westminster, you're in a cupboard.
I'm in a cupboard, what
This
we
is a
call
proper studio.
Millbank 5. And this one is called Millbank 1. And it's the big one.
Well, Millbank is the name of the BBC's newsroom at Westminster, which is gripped by two stories today. Number one, the government's 10-year plan for the NHS, which has been unveiled by the Health Secretary, Wes Streeting, today. And number two, the fallout from the Rachel Reeves appearance at PMQs on Wednesday. Let's do the second one first.
Yeah, so...
Where have we got to?
Well, they both overlap because
Yes.
hastily arranged, the Chancellor turned up at this launch that the Prime Minister and the Health Secretary for England, Wes Streeting, were giving in East London. Basically, because she had to. Politically, she had to show her face today. She had to demonstrate that she was getting on with the job. The Prime Minister had said that in the interview with Nick Robinson on Political Thinking on Wednesday night, but she just needed to get out there, and I think they kind of recognised that. So she turns up at the event. They all have sort of warm words to say. The Health Secretary, the Prime Minister obviously gave a fuller speech. She said a few things about the NHS, but then, of course, all the questions, alongside questions about the NHS, were, is the Chancellor all right? Does she want to say anything? Prime Minister was sort of saying what he'd said last night, which was it's a personal matter, we work in lockstep.
He
blah, blah,
clearly
blah.
feels he's drawn a line under it, but the media have got different ideas.
Well, I think there was a logic, an understandable... I wasn't at the event myself, but I think there was an understandable logic. I would say this, wouldn't I, as a journalist? But the Chancellor's there in the front row. Obviously, yesterday was quite a thing. It's not unreasonable to invite us to the microphone and say something. She didn't do in and of the event itself, but then did appear in what's known as a pool clip. I did one the other night with the Work and Pension Secretary today. Andy Bell of 5 News did one with the Chancellor, where we did hear her, in her own words, a sense of what had happened.
Well, clearly I was upset yesterday, and everyone could see that. It was a personal issue, and I'm not going to go into the details of that. But my job as Chancellor at 12 o'clock on a Wednesday is to be at PMQs next to the Prime Minister, supporting the government, and that's what I try to do. I guess the thing that maybe is a bit different between my job and many of your viewers is that when I'm having a tough day, it's on the telly, and most people don't have to deal with that.
Yeah, so she clearly hopes she's drawn a line under it there as well. She just didn't want to go there, did she?
No.
Any further?
No, she didn't. I mean, I think that, their strategy today was, look, they recognised that yesterday, for all sorts of reasons that we discussed on the previous edition, had meant that she was just very publicly very upset in a way that was impossible to walk past. And until you get to the point that she's come out and been seen in front of the cameras in a more sort of conventional guise, if you like, or more conventional circumstances, and crucially addressed the questions. I say the million questions. There were a million questions, but they effectively amounted to one, really, which is, how are you and what happened?
Yeah.
Then that question wasn't going to go away. So she addresses it and then sort of moves on. But then, of course, moves on, as she acknowledged today, to the even bigger headache that she now faces. How on earth does she fill that gap created by them not making the savings on benefits that they thought they were going to make?
And the price of government debt has gone back to where it was before this all happened.
Yeah.
So the justification for there being a real kind of fiscal monetary reason to talk about it, as opposed to just speculating about a person's emotional state, it sort of reverted back to where it was.
It did, and there's a couple of things you can sort of tease out of that. Firstly, it seems to me we shouldn't be surprised that there might be an immediate market reaction to a particular moment like that. Not so much the moment of, just somebody struggling in and of the moment, but because it prompted a concern for some who would regard it as concerning that she might not be Chancellor for very much longer. And arguably, if you're Rachel Reeves, you might look at that and think, oh, well, if there was a concern in the markets that I might go and be replaced by someone who was less fiscally prudent, as she might see it, then that rather shores up her fiscal strategy.
Well,
her whole approach about being careful of the fiscal rules and all that.
Yeah, so she's now unsackable from a market's point of view. She's unsackable from like an HR point of view based on what the Prime Minister said today. And maybe actually somebody who hasn't maybe necessarily connected with the public that well has shown a really human side. So actually this might end up being net positive for her.
It's a funny old thing, isn't it? How on the sort of the human side of things. I mean, of course, no doubt she wishes that hadn't happened yesterday, or maybe in time that she had clocked that she wasn't feeling great and therefore didn't go into the chamber or whatever. But in that sense, yeah, maybe just that. And then there's the other point, which is that, the Prime Minister and this Prime Minister and this Chancellor, this is always the case with every government, but this Prime Minister and this Chancellor, they do personify what has changed within the Labour Party over the last 5 years. The whole business of turning themselves into an electable opposition and then winning, and then that absolute emphasis on, her fiscal rules and being sort of treated seriously and credibly as far as Labour's attitude on the economy is concerned. Now, that causes some tricky old trade-offs, as my goodness she knows. But I've been really struck in the last 24 hours, and they've had to do it to an extent to shore each other up. But when the Chancellor is talking today, she's talking about working alongside the Prime Minister, and the Prime Minister is doing the mirroring thing.
Right, let's talk about the other story then, which is the launch of the NHS 10-year plan. This has been quite a long time coming, hasn't it? We thought it was going to be in the spring.
We did. So this is one of those things that they did set in train. They've faced accusations, haven't they, that a lot of stuff they've kind of only got round to once they're in government, a bit like the whole thing with the benefits thing. Why did they not get Stephen Timms, the minister, to start doing this last summer, goes the critique. The health stuff, they did have a fair old run-in on, because Lord Darcy, the surgeon and peer, did his sort of deep dive sort of analysis of where the NHS was, and then they've set in train the build up to this report. And the timing was intentional. They wanted the set piece moment of their first anniversary week to be talking about the NHS in the context of a 10-year plan, but also just ahead of its 77th birthday. NHS is comfortable territory on the whole for Labour as a movement to stride upon. They're proud of their role in its foundation, etc., etc. Now, of course, in the end, didn't quite turn out like that. But they make an argument, and the Prime Minister makes an argument, as we've heard today, that yes, the NHS needs plenty of money, and my goodness, it does. But you can't just carry on pouring money into the top. There's got to be reform, etc., etc. It's not the service that it was when it was founded, given that we're an ageing population with lots of us with multiple health conditions, etc., etc. But 10 years now, plenty will say, good on a government for thinking that long term. But that's third term territory for a Labour government, which is, from Labour's perspective, certainly as things look at the moment, optimistic.
Yeah, and this strategy it's long, and it's one of those strategies a bit like the national security strategy we got last week, a bit like the industrial strategy we got the week before, a bit like the defence review we got the week before that. It's a big chunky document with lots of fascinating things in it that a lot of thought's gone into. But again, one of those things where as a journalist you're like, right, there's 900 things in here. Does that mean there's kind of nothing in here?
Yeah, if you don't have a couple of priorities, maybe you don't have any priorities at all. And then you're dealing with this vast, complicated series of institutions that interlock in quite complicated ways, spread out in 1,000,001 different geographical locations. How do you try and sort of turn this oil tanker around with something this complex? The counter argument is one that says, you've got to think big and you've got to think long term, because the alternative is something that is only a 3 or 4 year horizon because of the political cycle, and how do you ever achieve anything on that kind of front? And
these things aren't just written for us journalists.
No,
in other words.
Exactly that. And in the argument the Prime Minister makes, that quote, a decade of national renewal, etc. The first year is about setting these things up, and then you hope over time to be able to deliver them. There's a bigger picture political point here, Adam, as well, which is that, and we haven't heard this expressed out loud in explicit terms yet, but a lot of thought that is going on within government, particularly with the rise of reform, which is, how do you make a sellable, political argument that Labour would see as being grounded in the, as they would see it, the moderate centre of British politics, when those arguments can seem quite long-term, perhaps a bit flat or stale, but which they believe are responsible, when you're up against an insurgency that can command headlines, is doing well in the opinion polls, can absolutely make an argument that says the Conservatives failed, maybe Labour are failing, give us a go. How do you make a compelling argument as an established party that can take on, and from Labour hope, beat the rise of reform? And I think somewhere in amongst all of these strategies and all this verbiage and all this long-term 10-year thing is the beginnings of a pitch to try and make that argument.
And the way of summing up this 10-year NHS plan, I think, is they say quite explicitly there's a danger or a risk that the NHS becomes a poor service only for poor people if action isn't taken to get it fit for the 21st century. And then they've boiled it down to 3 big shifts, which Wes Streeting has talked about before, but this puts a lot more flesh on those bones. There's a shift from treatment to preventing people getting ill in the first place. There's a shift from an analogue NHS of letters and fax machines and face-to-face appointments to more digital stuff, and that's built around a much better NHS app and also a single digital health record for every person. And then the other big shift, which they've been talking about today, is from hospitals to treatment in the community. And what they've focused on today to try and make us all understand what this is about is the concept of the neighbourhood health centre. So instead of going to the hospital to get your results of a scan or a blood test, you go to your neighbourhood health centre. And that is where I started the conversation with Stephen Kinnock, who's one of the health ministers who is out selling this 10-year plan today. And before Chris came into the studio, was sat in that very chair. Stephen, hello.
Hello.
I'll let you get a glass of water. There you go. A lot of talking today. Joe, first of all, this document is 168 pages long. On a day like this, do you know every single thing in it?
I have to admit that I don't. I think it's a brilliant plan which has got the right balance between being bold and ambitious and strategic, but also having some very tangible commitments and things that people can really feel and smell almost in terms of the change that we're going to bring forward.
I love that you promised it in the spring and it's now July, but never mind, we'll gloss over that. So just to bring it to life for people, imagine we're in 2035, everything has gone right with the legislation, the workforce, the capital investment, developing the app. Somebody gets diagnosed, I don't know, with cancer in 2035. Just paint a picture of kind of what their journey will be like in the NHS of the future.
Well, if you don't mind, I wouldn't mind starting a little bit upstream, which is to say, if somebody is referred into a neighbourhood health centre and there may be some concerns about their health, they will have right there a one-stop shop that will enable them to get the information that they need, get the care that they need in their community, a multidisciplinary team ranging from doctors, nurses, pharmacists, mental health workers, adult social care workers, palliative care, social prescribing, you name it, it will be in there. So that person will have, of course, may well need to then visit the hospital, and some of the advanced surgery and advanced treatment for cancer would be in secondary care, but then there wouldn't be constant need to go back in for rehab, for example, or for post-op support. That post-op support, diagnostics, rehab will be in the neighbourhood health centre. So my vision, our vision of that neighbourhood health service in 2035 is that you have got a one-stop shop for your health and social care needs there on your doorstep.
Just thinking the practicalities of delivering that, I mean, can you imagine that it's existing GP surgeries kind of get bigger, or is there going to be a kind of NHS building boom to build these neighbourhood health centres?
So our commitment is to 200 neighbourhood health centres across the country by the end of the planned period, 10 years, but with a focus in the early years on those parts of the country that have got the poorest health outcomes in terms of healthy life expectancy. It's going to be a mixture of refurbishing current premises, adapting them, changing them. I mean, the NHS has got this huge estate which isn't being used to the best of its potential, and then there will be some new build as well. So the amount of money being invested in neighbourhood health services can range from as low as £1 million for refurb all the way to £20 million for new build, and that's going to be developed in a bottom-up way through integrated care boards and all of the multidisciplinary teams working together.
And you
to
talked about the
identify
whole
the needs.
panoply of things that will be offered there. I mean, one of them you're mooting is debt advice. Does that mean NHS staff will be giving people advice on their personal finances, or is that a whole new group of people that you'll be bringing in to do that stuff?
The latter. I'm working with the voluntary sector, so we would be seeing multidisciplinary teams in a truly inclusive way. Employment advice being connected into the centre, enabling, so when you go into your GP will basically have right there at her or his disposal a team of people that you can be referred to immediately. And one of the things we have really been very clear on is that people's health status and outcomes is not always at all determined by clinical issues. It is so often determined by social issues, these so-called wider determinants of health. But there isn't a real interface, an integrated way of connecting those people into what they really need, rather than constantly reaching for diagnosis. And particularly in the case of mental health, it is often about debt, about housing, about employment status. So why don't we connect all of that in? Because so often it's people who are in those difficult situations, come in to see their GP because they're feeling really low, they've got real problems with mood, anxiety, depression. In many ways, the last thing they need is a diagnosis. The last thing they need is medication. They just need support, social prescribing, talking therapies. You know, this is a holistic way of treating patients.
Well, I mean,
that is modern healthcare in the 21st century.
I mean, we're talking about the future here, but that just makes me wonder, do you think now we're in a world where GPs are giving people, I don't know, antidepressants or anti-anxiety medication just because people have got bad debts, and actually GPs are reaching for a medical solution to a purely social thing?
I think GPs, I work a lot with GPs in my portfolio. I think they do an amazing job. They are the backbone of our health and care service, but I also recognise they sometimes have 15 minutes. They've got somebody who's in serious, issues with anxiety or depression caused by social determinants of the situation they're in their lives, and sometimes I think that does lead to just having to reach for a medical solution, when in fact what they need is social prescribing and all of the other therapies and support that are not medical. And I think that's the quantum leap that we need to take into a new way of seeing healthcare and understanding the holistic needs of the individual.
I'm just wondering how many people at the moment are sort of trapped taking antidepressants when actually they just need help with their debts. I mean, that's quite a bad situation. That's quite a bad system if that's what we've done to people.
I think if you look at the enormous rise in demand for mental health assessments, for example, you have to recognise that, people have been knocked for six by the pandemic. We have, I'm afraid, after 14 years of Tory neglect and incompetence, seen decline in our public services, decline in our economy, people of not feeling that they're going to have a more prosperous lives either for themselves or for their kids. That does have an impact on the mental health of the nation. The right way to address that is through the right types of support, the right support in the right place at the right time, not constantly reaching for diagnosis and for medication.
Right, let's talk about the NHS app. You've got big plans for that. It's going to have loads of different kind of sections or tabs where you can do loads of stuff.
Yeah, the app is going to be at the heart of our shift from analogue to digital. It's crazy that we live in a world where the NHS is still operating on the basis of faxes and letters. Why is it that people are doing their banking online, they're booking their travel online, the shopping, the all forms of other transport? It's all happening online, all happening on apps. Why isn't the NHS on that curve, riding that wave? That is what we want to change. So we have the NHS app already, and uptake is really improving. We're seeing a lot of appointments being booked now, which is saving hundreds of hours of staff time and administration. But we talk to far too many healthcare workers who say, I spend more time filling in forms than I do treating patients. That has to change. So we're going to use AI connected through into the app. We're going to have the single patient record. We're working on for example, on mental health, which we mentioned earlier, being able to refer yourself to talking therapies rather than constantly having to go through your GP. So it's about building out the functionality of the app.
Because actually, you're ditching the Rishi Sunak, Jeremy Hunt workforce plan, aren't you? You're going to have a different one.
Yeah,
so
we're gonna
potentially with fewer doctors in it.
Well, it has to reflect the 10-year plan. I think what we're actually doing is we're now. The horse is the 10-year plan. The cart is the workforce plan. We're actually finally putting the horse before the cart. And so we've defined the strategy of where we want to be by 2035. We now need to define the workforce that we need to deliver that. And that is going to mean those shifts from, in terms of workforce, resources, budgets, from hospital to community, and from sickness to prevention, and from analogue to digital.
And I don't want to be a downer here, but can you imagine some people in the NHS losing their jobs because they're not required anymore, because you need different skills from different people?
I think there's going to be a lot of change, and change always brings shifts in the way that people work. But of course, that change is going to take place over a number of years, and there will be retraining, reskilling, and new opportunities for people that really want to get on this journey with us.
But if you don't want to get on the journey, there's not a place for them.
Yeah, I think if you don't believe that the shift from hospital to community is the right way to go, if you don't believe, that the NHS, if you don't sort of see the NHS now as being too much of a sickness service rather than as a preventative service to enable people to get better and more healthy life outcomes, if you still believe that the NHS is an organisation that should be sending faxes, then this plan is probably not for you, and the future that we have set out today is probably not for you either.
Will you have to negotiate some of this with the professional bodies? So like the people that represent doctors, for example?
Yeah, I think if you look at the neighbourhood health service, we want that to be GP-led. That means we want to design it, co-produce it with the GPs. How should it work in practice? How are these multidisciplinary teams going to work? How is the GP, almost as the conductor of the orchestra, going to make sure that every instrument in the orchestra knows their cues, knows what tunes they need to be playing? That is going to be, I don't know if you call that a negotiation, I would call it more a partnership, where we work together, because trying to design these things from an ivory tower in Whitehall or Westminster never works.
No, the reason I call it a negotiation is because, as you well know, people like the BMA can say no to things. We're not going to deliver this thing you want us to. Oh, and we might go on strike over it. That's why I talk about a negotiation.
Well, I work closely with the GP side of the BMA, and my impression strongly is that they really welcome this and see it as a huge opportunity to finally get that shift.
I wanted to ask you about Rachel Reeves, but I know you'll say, oh, she was emotional for personal reasons, and we'll give her that. But I just wanted to understand what it's like in the House of Commons in those moments, because, I mean, you guys are all colleagues and mates and friends and professionals. Why did she end up sat on the front bench when she's clearly not in a state to be there for whatever reason? Like, wouldn't you as a human being be like, are you all right? Why don't you sit this one out?
Well, Rachel is a true professional, utterly dedicated to the work she does. And Prime Minister's Questions is a big moment every week. And I think the Chancellor of the Exchequer wants to be shoulder to shoulder with the Prime Minister, right there on the front bench, showing that the government is strong and united, and also dealing with some of the nonsense that you hear from Kemi Badenoch and her team from the other side of the chamber. So I think that will have been absolutely where Rachel was when she went into that session. Clearly, as the session went on after she had been in there for a little while, clearly there's something that's in her personal life, and it's none of our business to even wonder what that is, but that she started to get upset. And so I think it looks like it was a situation that evolved some time after she'd gone into the chamber. And she was
kind of trapped there, maybe.
I think then, with all
anyway,
due,
I'm not trying
respect,
to get you to speculate.
Yeah, with all due respect to our colleagues in the media, I suspect if she had got upset and then stood up and walked out of the chamber,
it would be worse.
That would have been something that you'd be asking me about right now as well. So, what do you do? There's obviously something very upsetting gone on there, and I think now, but it was wonderful to see her at the launch of the 10-year plan today. She was on great form this morning, and she's so proud, I think, because of the decisions that she's taken as a vitally important part of the government, that we've been able to generate the £29 billion that we are investing to make this 10-year plan a reality.
Last question. It's the 1 year anniversary of the government in a couple of days. Is that the sort of thing like you celebrate? Do you crack open a can of low alcohol lager, which you're now promoting through the NHS 10-year plan?
Yeah. I will definitely be looking back and I don't know,
cringing somewhat.
raising a glass. No, seriously, because I think when you look at it, we said we would deliver 2 million extra elective appointments. We've delivered 4 million. We've got NHS waiting lists falling for the first time in 2 years. We've done 2 trade deals. We've got interest rates falling 4 times on the bounce. We've created 384,000 new jobs, breakfast clubs in schools.
3 big U-turns.
But they've been bumpy moments. I absolutely accept that. It has been an intense and at times quite turbulent 12 months. But I think when you look at those incremental steps towards making Britain a better country after the total and utter car crash that we inherited a year ago, I think we're making serious progress, steps in the right direction. Yes, some mistakes have been made. Hands up, absolutely accept that. We're learning from those mistakes. And I think in these next 12 months, we're really going to start seeing the government firing on all cylinders.
Right, and I've probably earned 100 NHS points for interviewing a health minister. So, or maybe, I don't know, maybe that gets you 1 million, I don't know. Stephen, thank you.
And a gold star.
Well, thank you very much.
Thank you.